Hi, I'm Xingyi. Welcome to the Smile Project, the podcast of the School of Dentistry, IMU. Thank you for joining us today. This section of the Smile Project is called the Dental Bites. Tune in to this section for bite-sized learning on the go. So let's begin. Joining us today is Dr. Spoorthi, oral maxillofacial pathologist in School of Dentistry, IMU. The topic for today is Patho-lingo with Dr. Spoorthi. So, doctor, as students, we find some pathological terms that we read in textbooks difficult to understand. So can you explain those terms so we can get a better understanding of it?
Thank you, Chinny. Thank you for inviting me for this podcast, and I'm really excited to be part of this. I can totally relate to this student's difficulty of not understanding certain pathological terms, but to be very frank, to cover those pathological terms in 5 minutes will be a little tricky. So let's divide it. Let's confine our discussion today for epithelial changes. So I'll try to explain certain terms which are for epithelium alone. So when we see epithelial changes, you might come across certain words like dysplasia, acanthosis, hyperkeratosis, atypia, pleomorphism. There are numerous terms, right? So let's take one by one. When we say acanthosis, that simply means increase in the spinous cell layer. Acanthe means spinous. So when we say acanthosis, it's increase in the spinous cell layer. Likewise, if you come across a word acantholysis, that means it's breakdown in the spinous cell layer. Certain terms like hyperkeratosis or keratosis is there. Simple, hyper, more, keratosis. So epithelial cells, as they mature, they produce keratin on surface. That's a normal physiology. But when that goes wrong, more amount of keratin can be produced, and that leads to hyperkeratosis. That can be due to friction. In such case, we call frictional keratosis. As a norm physiology, the keratin has to be produced on the surface of the epithelial cells. But sometimes this keratin can produce inside the epithelium itself. In such case, we call dyskeratosis. Dys is abnormal keratosis. So it's simply abnormal keratosis. When I say dyskeratosis, this brings me to discuss about dysplasia, which is given high importance. Of course, it needs to be because dysplasia is a precursor lesion for cancer. Now, what is dysplasia? Plasia means growth, dys is abnormal. So any abnormal growth in the epithelium, we simply call it as dysplasia. But keep in mind that dysplasia is, as I told before, it's a precursor lesion. So if we identify dysplastic features, a pathologist need to be more attentive when reporting such slides. When I say about dysplasia, I think we should also talk about atypia. Sometimes these are synonymously used, but we shouldn't. When we say atypia, atypia literally means changes at the cellular level, and when we say dysplasia, abnormal changes at the tissue level. When these dysplastic features are put together, you see cells in different aspects, showing multiple forms. Some cells are large, some cells are small. Cell has bigger nucleus, smaller nucleus, darker staining nucleus. All these are put together and we call it as pleomorphism. So dysplasia, atypia, pleomorphism, all these are collectively put and reported when a pathologist reports the slide. Sometimes we also see epithelial cells showing atrophy. Now atrophy is the cells are receding down, the cells are going down, and they're showing atrophic features. We no more see epithelial rete-ridges, rete-pegs. Instead, we just see flat ribbon-shaped epithelium. We might also come across some words like intraepithelial, subepithelial. These are simple terms. As the name suggests, intra means inside the epithelium. Sub means below the epithelium. Similar to that, we also have a word called juxtaepithelial. When somebody says juxtaepithelial, that means it is just next to the epithelium. We have epithelium and the connective tissue. So when juxtaepithelium means it is just next to the epithelium, just below the basement membrane is juxtaepithelium. In some inflammatory conditions, we come across words like spongiotic epithelium, edematous epithelium. So whenever you see edematous fluid within the epithelium, we call spongiotic epithelium. I believe these explanations will be helpful for students to understand the confusing terms. Perhaps in the next episode, we'll see what are the other pathological terms, changes in the connective tissue or other pathological terms which are confusing. Thank you so much.
Thank you so much, doctor, for joining, and see you in the next episode.
Thank you.